you guys a heads up on this. The electrolyte imbalance, the one that's really important for you to remember for your exit and NCLEX preparation. The top three that you really have to know here is sodium, okay, calcium, and potassium. Those are the three big ones. They don't really ask that much on chloride and phosphorus, so it's really not a big priority. Because even on your exit and when you take the boards, those three big ones are the ones they ask the most. You know, sodium, potassium, and calcium. Now don't forget, sometimes they don't call sodium as sodium. They call it natremia. Okay, so that's why I added that term there, so that I want to make sure you guys are aware that when they say natremia, they mean sodium. And when they say kalemia, they mean potassium. And when they say calcemia, they mean calcium. Okay? So don't forget, that's the three biggest priorities here on this list. Even on your exit, that's what they're going to ask you. Okay? The potassium, sodium, and calcium. What you have to remember here though, this is what they ask on your exit and also on your NCLEX, are what are the signs and symptoms that the patient will experience if they have hyper or hypo. That's what they usually ask. Hyper and hypo sign. Okay? So let's say for example, we all know when it comes to potassium or kalemia, right, is responsible for cardiac function or the heart. Here we're looking for signs and symptoms related to where? The heart. Okay? So that's how you want to study this. Although you know the range, you have to have an idea also what's the normal range, but know what are the signs and symptoms when they're hypo and hyper, because that's what they're going to be asking. Believe me, that's what they're going to be asking. Okay, so make sure that you know the signs and symptoms when they're hypo and hyper. So you don't have to read all of this, just know signs and symptoms when they're hypo and hyper. Okay? Alright. Okay, so going back to priorities, that's that thing here. Okay, here's another example of prioritization. The nurse is collecting data from a client who has myasthenia gravis. That's a problem with muscle weakness, right? Which of the following findings is the highest priority? So by using your ABCD, the priority will be letter D, right? ABCD, ineffective airway pattern. The only time that that's not going to be the answer is if it had the word risk. But it didn't have the risk. So the answer would be airway, breathing, circulation. Okay? Alright, so here's another one. Let's take a look at this. Another perfect example of what they usually, ask in regards to prioritization. The nurse is working in a long-term care facility, is assigned 4 patients, following a 7 a.m. morning change of shift report. Which of the following clients should the nurse attend to first? Again, when it's like that, you see systems that's on the option, you will use what? Airway, breathing, circulation. Now, other than that, make sure you're also aware of acute versus chronic and actual versus risk. But you need to have a little bit of knowledge also on med-surg in this one. Give you guys some time. Make sure that you can practice. You get used to it. You get used to reading and finding out, the data, the information. So what's the answer? Letter A, right. So, all of them are actually chronic, right? Diabetes chronic, bronchitis not really chronic, it's acute. But here's the thing, there's already what? There's already treatment. So you do not prioritize a condition that's already being what? Being treated. That's no longer the priority. Why? There's already something being done, even if it's an acute, right? COPD, Alzheimer's, chronic. Nothing really wrong with the Alzheimer's patient and COPD patient. That's expected of their condition. But diabetes is chronic, but the diabetic patient is experiencing something acute. What is it? Hypoglycemia. because we all know the normal blood sugar is 70 to 120. So anything below 70 is considered hypoglycemia. Okay, so acute. Very good. Good job. Good. Woo. Awesome. Okay, let's take a look. I want to give you guys as much variety as I can so that you can see it. You practice. The nurse is collecting data on a client with a major burn injury. The nurse should recognize that which of the following findings is a priority. You have a patient that got burnt. What do you think would be the priority for this patient? What do you think is the answer? Answer is letter C. Because letter C is the one that has relationship to airway. Sputum. Sputum has a direct relationship to airway. And it says burnt, right? So meaning we have damage to the airway, which can become a problem with airway obstruction. Okay, good. Ooh, very good. All right, the next one. You're gonna see this a lot also. Delegating things to your UAP. That's a big one. They ask that often also on your exits. They ask that on your NCLEX. What do you delegate? When I talk to my UAP, what do I delegate to my UAP? Okay, so let's go over some of the things that you can delegate. Bathing, grooming, right? Dressing, toileting, ambulating, and feeding, except for patient that has the diagnosis of dysphagia. When you see the word dysphagia, what does the term dysphagia mean? Difficulty swallowing. Why can't a UAP assist a patient with dysphagia? When you assist a patient with dysphagia with feeding, you need to coach. You need to give instruction on how to properly swallow. Can a UAP coach and give instructions? No. You gotta remember that. No, they cannot, right? Although in real life we see them doing that, but for the NCLEX, for your exit, no, right? Other than that, repositioning a client, bed making, collecting specimen. I'm telling you now, they can collect specimen. Okay, what it is? Stool,
urine,
sputum, right? As long as the sputum is being collected by what? Not using suction. They can actually cop it out. If the patient can cop it out, expectorate it on their own, the UAP can collect that. But if it requires suctioning, right, the UAP cannot. Because when you suction, you need to do what? An assessment. Okay? Blood. There's one blood that the UAP can collect. Blood sugar. Don't forget that. A UAP is allowed to check blood sugar using a glucometer as long as the patient doesn't have an acute condition, meaning they're only diabetic, right? Okay, but if they have DKA, they have hypoglycemia, right? Then no, they can't, right? Okay. They have change of condition, they can't check the glucose. The other thing that the UAP can do, vital signs. They can check all the vital signs as long as the patient is stable and chronic condition. They can measure intake and output. Okay? And they can also perform enema and put on a condom catheter. But here's the thing, they cannot give suppositories. What's the difference between enema and suppositories? A suppository is a medication. That's right. An enema is not. Especially if it says water or top water enema or soap sud, it's not a medication. So that can be given by the UAP. But if it's a suppository, they can't because suppository is a medication. Now, I want you guys to be careful. The exit and the NCLEX is very tricky. They're gonna say this. They're gonna say this. The patient needs a stool sample for occult blood. Can a UAP collect sample for occult blood or stool OB?
Yes.
Answer is yes?
No.
No?
Blood, yes, because it's just a sample and they send it off. They're not doing
Can they actually collect that, the stool?
it. you as a patient can send in a code.
The answer is yes. Okay, yes. So here's the thing. They make it tricky because they made it sound complicated, but the reality is they're only collecting what? Stool. So no matter what, even if they say stool OB, stool for OBA and parasite, stool for, like, let's say for example, infection or like, other stuff, they can collect it because they're only collecting what? Stool. Even if they say collecting stool from a newly admitted patient, can the UAP do that? Yes, they just make it complicated. They just want you to, like, change your answer. They just add the word newly admitted patient. Because why? Even if it's new, the UAP is only collecting what? Stool. Don't forget that. Okay, they will make things complicated for you, make you think twice. But as long as it's stool, because it's not sterile, they can collect.
What about if it's from a colonoscopy bag?
They can.
It just doesn't matter.
Because it's not sterile. As long as the process is not sterile, the UAP can do that. The only thing that the UAP cannot do is procedures that are what? Sterile. Like, let's say, can they actually collect from a Foley catheter port? Not from a port, but where can they actually collect?
The phone.
From the bag. Right? From the bag. They can collect from the bag, that's not sterile, but the port of the Foley catheter is sterile. It requires sterile technique, so they can collect. Can they actually do a straight cat to collect urine?
Yes.
A straight cat? No, straight cat requires what? Sterile technique. Right? How about a clean catch midstream?
Yes.
Yes, because you're only asking the patient to urinate, pee. Right? So always remember that. The simpler the process, the simpler the procedure, as long as it's not sterile, it can be delegated to the UAP. Okay, now, can a UAP actually check legal documents?
No.
The answer is no. Yes, that's correct. They cannot check legal documents found in the patient's chart. So do not think of that. Even if it's simple, do not think of that. The only thing they can do is intake and output on the chart. And if they need to write some of their notes, just for the intake and output as a UAP. Okay, is that clear, guys? Alright, very good. Now, can a UAP touch a feeding tube pump, an oxygen machine? Can they touch it? Can they actually change the setting? No. So always remember that too. One of the things I always say to my student, in order for you to pass the exit and pass the NCLEX, forget about some of the things you see in your clinicals. Don't use it. Don't even think about it. Why? What you see in your clinicals is the real life. That's not real. A lot of things that happens there is not something that they can legally do. So if you see a UAP turning off the oxygen, machine, or turning off the feeding pump, guess what? In reality, they shouldn't be doing that. They cannot do that as a UAP. Okay? It's the responsibility of the licensed nurse. Okay? Alright. Very good. Let's take a look. Alright, so here it is. The nurse assesses a client with a pacemaker while the UAP measures the client's vital signs. The client's vital signs change suddenly, and the nurse determines that the client's condition is worsening. So, meaning we have an acute or chronic condition. Acute. So we have an acute condition. So you have to think about that. The patient is acute. The nurse is unsure of the client's resuscitative status, right? What's the, is it DNR, is it full code, right? And needs to check the client's medical record for an advance directive. I'm telling you now, that's on your exit, that's also on your NCLEX, advance directive. They ask that a lot. Okay? Now, which action should the nurse implement based on this, working with the UAP? Letter A, ask the UAP to check for advance directives while the nurse completes the assessment. Letter B, assign the UAP to complete the assessment while the nurse checks for the advance directive. Letter C, check the medical record for advance directive, then complete the client's assessment. Letter D, hard to read, request the UAP to call the charge nurse for the charge nurse to check the advance directive while continuing to assess the client. So you're telling the UAP, go and call the charge nurse, and tells the charge nurse to check for advance directive. What do you think is the answer? Letter? Letter D. That's the right answer. Okay? Why? Two things. A few things that I mentioned to you guys. Can a UAP be asked to assess? No. Can the UAP in this case check vital signs? In this case? No, because the patient's condition is worsening, meaning acute. So they can't check vital signs. So out of the question, right? Can a UAP check legal document like advance directives? No. So the only thing that the UAP can do at this point is call the charge nurse, tell the charge nurse, can you check for us the patient's what? Advance directive. Okay? You gotta remember that because if you don't remember those things, the limitations, it's hard for you to find the answer. Okay, so that's the right answer, letter D. Okay, very good. Good. Alright, here's another one. Gotta remember what they can do is to make it easy for you. The LPN and the UAP enters the patient's room and found the patient unresponsive. Acute or chronic? Acute. So put that into mind again. We are caring for a patient that is acute. You gotta remember that because that will limit what your UAP can do, right? That will limit it. The patient is unresponsive on the bed. Okay? Based on this finding, what will the nurse do initially? There's another clue. Initially. It's a little bit hard though because it's kind of, you gotta find the correlationship. But as long as you remember what we discussed, you'll find the answer because you can eliminate a lot of stuff. What do you guys think is the answer? Letter? Letter C. Correct. Because why? We're looking for something that the nurse needs to do what? Initially. Which means we're gonna have to find an answer that's gonna what? Assess. And the only thing that leads to assessment here is what? The glucometer, which the UAP can do. Because letter B is an assessment, but here's the problem though. Can the UAP actually do that in this situation? No, because the patient is acute. Eliminate B, right? Ask the UAP to check advance directive. That's legal document. Eliminate. So we're only left with what? C and D. And we're looking for something that is an assessment, right? Initially. So we don't really call initially 911 yet unless we really need what? 911. Because remember, it said unresponsive. It didn't say what? No pulse, not breathing. It didn't say that. If it did say that though, that no pulse, no breathing, there's data, right? Then the answer here would be what? Call 911. Alright, so you remember that, okay? Good. You guys are like getting already, you see that? Jump into that answer. Very good. Alright, awesome. Okay, next, cultural nursing. Cultural type of questions comes up. Even on the NCLEX, even on your exit. Okay, now, when it comes to culture, specifically on the NCLEX and on exit itself, the usual focus is Orthodox Jews and Muslim culture or religion. That's the usual focus. Okay, now, there are going to be some focus like Jehovah's Witness, especially on NCLEX, and the part that you have to remember on Jehovah's Witness is blood transfusion, right? Don't forget, they actually do that now. It's acceptable for a Jehovah's Witness to have blood transfusion as long as the blood came from themselves. Okay? So that's it. That's the thing now that you have to remember. They're very tricky now on Jehovah's Witness questions because they use autologous. They say autologous blood transfusion. If they say that, pick that because that means the blood came from the patient. They accept that. Okay? The other thing that they also come up that's not here on the list is Seventh-day Adventist. Seventh-day Adventist, one of the things you gotta remember for them is Saturday is a holy day, meaning no diagnostic tests or procedures at all on a Saturday. They're not supposed to do anything on a Saturday. Why? They're supposed to be resting even if they're a patient. So, if you assign them to have a follow-up on a Saturday, guess what? They're not gonna go. That's something that you have to remember on the Seventh-day Adventist. And also, they don't eat meat or animals that crawl. So crawling animals like crabs, seahorses. Okay, so something to remember. Now, the focus though, the biggest ones that you see on your exit and on your NCLEX, Muslims and Orthodox Jews. Let's take a look. Okay, now before we go there, I know there's a few other things that we will look at here, but let's take a look at this first. A perfect example of one of their focus. The nurse is supervising a newly licensed nurse who is female while she performs post-mortem care. So I just want to add that. Can a post-mortem care be delegated to a UAP?
Yes.
The answer is yes. Very good. Yes. Post-mortem care can actually be done by the UAP. Okay, so don't forget that also. So here's the thing, female, while she would perform post-mortem care on a male client who is Muslim. Which of the following action by the newly licensed nurse should prompt the nurse to intervene? So when you see the word intervene, needs additional teaching or needs teaching reinforcement, we're looking for an answer or an action that was done what? Wrong. That was done incorrectly, right? That was done wrong. We're looking for an action or something that was said that's wrong. So based on this, based on the option, which one do you think is something that was done wrong on this post-mortem care of a Muslim patient? And remember this, okay, because that's the focus, Muslim and Orthodox Jews, especially for my exit students. The answer is letter B. That's correct. Very good. Good job. Good job. Now, there you go. Awesome. Why? Number one rule when it comes to post-mortem care on a patient that has a Muslim religion, it has to be the family to do it, and it has to be the family member of the same sex. Meaning that if the patient is male, the one that has to do it is also male. Now, when it comes to patient care, not post-mortem care, like regular care, they also require what? A male nurse. They cannot have a female nurse. If the patient is female, then the patient can have a female nurse. Don't forget that, okay, when it comes to patient with Muslim religion. Now, here's the other thing. A is correct because remember, any kind of post-mortem care, you don't remove the dentures. Why is the reason why you don't remove the dentures? If you remove it, they don't look the same, right? You alter the face, so you don't want to do that, okay? Disconnect cardiac monitor, that's right, you do that. Once patient is post-mortem care, you have to remove all of the gadgets. You can't leave that there. Okay, especially when the family comes in to check the patient. And of course, you remove soil linens, right? So that's right, that's not actually something that's wrong. So the answer is letter B. They can't the nurse can't do it. She's female, she's not member of the family, so she can't do post-mortem care. Alright, here's another one. A nurse is contributing to the plan of care for a client who practices the Muslim faith. Which of the following actions should the nurse include in the plan? Something related to meal. Now, just let you know, this is one of those things that they ask often. Meals. Even for Orthodox Jews, they ask about meals. Okay? About food. I'm sure you guys know this, right? What's the answer? Letter C, correct. Muslim religion, Muslim faith, no pork. You cannot eat pork. Okay, so based on their religion, pork, pig is something that's unclean. Alright, very good. The other things, yeah, they're okay. Alright, so just again, the reminder, a few things. The focus is on Orthodox Jews and Muslim. Okay, so when you go through the other slides, just make sure that you remember things about Orthodox Jews and Muslim. But for NCLEX though, please also remember about Jehovah's Witness, okay, and Seventh-day Adventists, because that comes out also. Okay, for NCLEX.
There's a difference between the Eastern and the
Not so much with the Orthodox Jews.
Jews, oh, are just,
They just pretty much like follow the same protocol. Okay, so a few things on, you know, cremation and burial. Hindus, you know, when it comes to this, their ashes has to be cast in the holy river. For Mormons, it actually prohibits cremation. Orthodox Jews prohibits it. Muslim religion prohibits it, and also Jews prohibits it. Okay, just a few things on Baptist, not really that important, it's just here part of the slide. Okay, so here we go, the important one, Orthodox Jews. Let's discuss a little bit about them as well. So, one more thing that I want to add on Muslim that you gotta remember, when a patient dies of Muslim religion, they need to be facing east. Okay, so if this is east, when Muslim faith dies, they have to be facing east, which is Mecca. That's the location of Mecca. So that's something to remember for Muslim faith, that they have to be facing east if the patient dies. Okay? Now,
Why are they supposed to face east?
because of
Because of
Mecca,
Mecca.
the holy city. They have to be facing the holy city of Mecca. Alright. A nurse is observing an AP who's preparing to deliver a meal tray, okay, to an Orthodox Judaism patient. On the tray is a roast beef dinner with non-fat milk. Which of the following actions should the nurse take? So this is important, especially for those who can take the action. This is one of those things that they ask on Orthodox Jews, meals. Take a look at the option and remember, you know, I know this is sometimes very vague because it's been a long time, right, on religion and, you know, ethics. But we'll try to, as much as possible, recall it. What do you think are some things that we need to remember for Orthodox Jews about meals? The answer is? The answer is, what do you guys think? The answer is letter B as in bull. Okay, why? So here's the rule. This is very important. When it comes to Orthodox Judaism or Jews in general for their religion, you cannot have two animal products in the same tray. When you put that together already in the same tray, the entire tray becomes, you know, contaminated. It becomes tainted. So what does that mean? You cannot give the same tray even if you change what's in there. Okay, you cannot do that because that's the entire tray is tainted. In this situation, what was the two animal products that was actually on the tray? The roast beef and the milk. They can't have that there. So that means the entire tray needs to be what? Changed. Okay? The other thing, you gotta remember, no pork, right? For Orthodox Jews. Also, they don't eat seafood without fins and scale. So what does that mean? If it's clam, if it is crab, if it is lobster, they don't eat that. It has to have what? Fins and scale. Like what? Like
Fish.
halibut, right? Or trout, or salmon. That's what they eat.
So pretty
And-
much no shellfish.
Shellfish, no. No shellfish at all. You gotta remember that, okay? Plus, there's a special preparation. What's the special preparation called for Orthodox Jews? Kosher. Right? Things should be kosher.
but, but that's asking, so the question's saying that if, okay, the beef and the non-milk's on the tray, like you're saying, and they will not eat it because it has bone.
Yes.
but it's saying that the nurse is gonna explain why it's on there and they need to do that.
No. So
That's the way it sounds
oh,
to me.
this
That's
one
why.
letter D. The answer is actually B, not D.
Oh, I thought you said D, that's
not
why
D.
it was,
Yeah,
he
that's why I'm
said,
probably confused.
Yes.
No, not B. D.
I'm sorry.
The answer is B. Sorry
That's why I was
guys,
like,
it's
wait,
B. Yeah,
it's-
yeah. It's B. It just
Okay.
sounded D, but it's B.
Okay.
The answer is B. Okay. Yeah.
Okay.
D, no, don't do that. Oh my God, they're gonna
Yeah,
be
that's
furious.
why I was like,
Yeah.
wait a minute, you're explaining something, yeah.
Yeah, your patient's gonna be furious. Letter B is the answer. Change the tray. That will make it a lot better. Okay. Here's another one. The nurse is caring for a client. Orthodox Judaism. The nurse should identify that which of the following food together on the same dinner tray violates the practice. What kind of food on the same dinner tray will violate the practice? The answer is letter A.
The
Very
scale.
good, right? We have two animals, specifically even if it's kosher.
So far, I feel like
And
I'm
we
doing
also
most
have
of
a
them.
fish
But why can't
food
I do
that's
the
not
show?
what? Fish and scale. It's very important to remember for Orthodox Judaism, right? Everything else is good. We got carrots, we got cottage cheese. Chicken sandwich, be careful. Do not pick a chicken sandwich with cheese. Okay? Don't pick that with cheese because cheese is also what? An animal product. Okay, so that's very, very important. But another one, of course, potatoes and chicken breast. We're good. We're good with that. Okay? Alright. Don't forget that, okay, when it comes to Orthodox Jews. Okay?
So does the Orthodox, they don't do other animals or?
Hi, Miss
also-
Villanueva.
Wanna stop, say hi.
There you go.
Wanna send you guys lots of love.
There you go.
Guys,
you.
this is your last Valentine's Day as a student. LVM student.
Next year, licensed nurses. Ooh.
Woo! Yeah, next year will be Valentine's Day,
There you
not in
go.
the classroom, probably at work, but it's okay.
You're always welcome, Miss Villanueva. So, not kosher, not good, right? It has to be kosher. That's a special preparation ritual for any meal. A few things to remember: no scavenger like birds, like eagles, gulls. Okay, hawks. They also don't eat that. And then also they don't eat goats, deers. Okay, so roebuck, gazelles, mountain sheep. So you know. Okay. So here are the things, right? Even the beef, they don't actually see cuts of beef that come from the hindquarters, meaning from the back. They don't even eat it. But don't worry, it's not that complicated. Just remember that they can eat beef. Okay, it's not that
So-
complicated.
But they, excuse me, the you said chickens, they will? Or?
Chickens, ducks, they will. Mountain sheep, that's okay as long as they have club hooves. That's the important thing. Club hooves. You know, like the hooves are like this kind of.
Not really. That's not like, we have to know everything about
No, you don't have to
animals
know
and-
that. Just know that here's the important thing. No two animal products on the same tray and no shellfish type of stuff, okay? Yeah. That's it. You're good with that. You don't have to know that one, the rest, okay? You're good.
So whether it's like the actual
Yeah, like
meat
whether it's
or
kangaroo
like cheese
or
or something.
squirrel, you don't have to remember that kangaroo and squirrel, no. Here's one thing you have to remember though. Pig.
No pig.
No pig. You gotta remember that. No pork, okay? Yeah. Alright, so just a few things there. Okay, just a few things to remember. Again, for NCLEX, please remember Seventh-day Adventist and Jehovah's Witness because it comes out of NCLEX. For exit, focus more on Muslim and Orthodox Jews. Okay? Alright, next, legality and ethic. We'll just go through this really quick and then we'll go on your 30 minutes dinner. Okay? Alright, legality and ethic. First thing, here we go. There are gonna be torts. They're gonna be asking you torts. So when we say torts, that's the term that they call it on the test, especially on your exit and then flex. Torts means something that is not legal. You're not supposed to do that. Torts are something that is, against the law if you do it, right? So here's some example of those torts. Let's identify them, okay, and let's find out. A nurse is caring for a client who is competent, refuses further treatment, and asked to sign out of the hospital against medical leave. So they want to sign an AMA, right? Don't want to do this. I want to go. The nurse notifies the charge nurse, who tells the nurse that the provider has recommended restraining the client. Restrain him, right? If necessary. Okay. The only time that that's applicable is if the question says what? 5150, meaning
Yeah.
danger to self and others. But if not,
So it's false.
yeah, there's a problem there if you do that, right? Okay. But it didn't say that the patient's 5150. So to keep her from leaving the hospital, the nurse refuses to implement the action based on the knowledge that restraining the client will resort to what torts?
False imprisonment.
False imprisonment. Very good. That's the answer right there. Okay? It's not invasion of privacy. Invasion of privacy means what? You're going through their personal belongings without you really related to their care, right? Assault, when it's an assault, it's something that I will kick you, but I didn't really kick you. I just said, I'm gonna kick you if you leave. So that's an assault, meaning it's only what? Verbal.
Verbals.
But
Okay,
if
I was
I
like,
say,
wait, how's that? Yeah.
right? But if I say I'm gonna kick you and I actually kicked you, that's
Then
a
that's
what?
battery.
That's a battery. That's right. Okay, so don't forget that, okay?
That's why it's called an assault battery.
There you go. Alright, very good. Let's take a look at this one. A provider prescribes a brief period of strict bed rest for a client who is post-operative. The client calls the nurse and asks to use the bedside commode. Knowing that the nurse from the previous shift allowed the client to get out of bed and use the commode, she assists the client to the commode. Here's the problem though. The client sustained an injury to the operative area, okay, while doing that, out of bed. Which of the following type of tort was actually committed? It's what? It's negligence. Correct. They're negligent of the fact that they should have known and followed that the patient is what? Bed rest. They shouldn't be ambulating the client. Okay? They went beyond what is the recommendation, so they were negligent of the care. So don't forget that. When they go beyond, they don't follow the instruction, negligence. Okay? So don't forget, because they'll be asking torts, okay? One more thing that we will actually discuss in mental health is actually defense mechanism. They ask that too in your exit. What is the kind of defense mechanism they're using? Okay, let's take a look at this one. So an example. The nurse is caring for an adult client who is competent and has refused the analgesic injection. The nurse administers the injection despite the client saying, "No, don't give it to me." Which of the following types of torts was committed?
Assault.
It is they injected the analgesic. Battery. Okay? They injected it, meaning they actually did it.
Oh, that's right.
But they actually did it, it's a battery. Okay. And then, there you go. Okay? Alright, so if it's a threat, it's an assault. If it's an actual carrying out the action, it is a battery. Don't forget that. Okay, and don't forget also, they also ask that the negligent and the false imprisonment. Okay, here's another example of false imprisonment. Using all of the side rails, right? False imprisonment. Using restraints without actual reason for the restraint, false imprisonment. Okay. Very good. Don't
But
forget.
isn't there a, where they can without
Use a
having
restraint?
it?
Oh yeah.
No, all four.
All four side rails can be a restraint as long as there is danger to self and others. Yeah, because that will
That's
become as a
the one.
form of a
I
restraint.
thought there was one other one where like the bed rails and stuff.
Yeah, as long as it's the safety issue, you can use a restraint. So don't forget the other definition here, guys, okay? And then negligence and malpractice. We're
So
already
would
good.
a fall risk if they put us the bed rails and that would seem,
It wouldn't be. It would be more of an enforcement.
oh, that, so it wouldn't be safety,
It wouldn't be
safety?
Safety issue, no. It won't be a safety
Like if
issue
they're
unless they actually fall. If they did fall, then that became a safety issue. But first of all, though, when you're using all sideways, it's first of all, false imprisonment. It's a restraint. Yeah, it becomes a restraint. Okay?
I'm like, I don't think you said it, okay.
Alright, so, let me see. So, we're gonna go to the restraint next, but before we go there, let's take your dinner. Okay, go to dinner, be back by 7:50 and